Hello, my name is Dr. Pat Santucci, Medical Director of ANID, and I would like to welcome you to ANID's educational series for individuals concerned about eating disorders. This is part 2 on the series of Orthorexia Nervosa, when healthy eating the road to recovery, and we'll be focusing on tips for tedious route. But it starts with some basic principles. Number 1, awareness that there is a problem, and that calls for education as to what the issues really are. Number 2 is accepting that you have a problem. That's oftentimes a difficult thing. We can see it in others, but it's hard to accept and see it in ourselves. The third is determining the motivation to change. Not everybody wants to change, and not everybody is ready for change. But once that determination is made, then it's putting a plan in place. So let's start looking at some of these factors. Whenever I think about change, I think about asking the miracle question. And the miracle question is, how would life be different if tomorrow I woke up and I didn't have to worry about food? Well, then the second question I usually ask myself is, why would I want to change? And of course that says to me, where would I be 10 years from now if I don't change? Now, people have reasons to change and reasons not to change. And your reasons are very specific, so take this moment and take a look at why are reasons that you might want to change and why are reasons that you might not want to change. But in general, again, people change for 2 reasons. Either they've learned enough that they want to, or they've been hurt enough that they have to. The other question I ask is, how do you want to fill your life, your circle of life? What do you want to fill it with? Relationships, family, school, food, health, hobbies, whatever that balance and moderation, which would give you a healthy living lifestyle. And how do you live your circle of life now? How much of that circle is preoccupied by food and fears of food and wellness and issues around healthy eating? How much of that circle would you want to change and put in other things that are important to you? Well, are you ready for change? Let's be honest, not everybody is ready to change. And there are these stages of change, and probably the first one is pre-contemplation. No, I don't have a problem, I'm not ready, I'm fine. That second phase is scratch your head and say, well, maybe, I'm not sure, maybe. The third is kind of, yes, let's go, motivated. Well, saying it and doing it are 2 different things. So action is the next phase. But then we put into action and then we find out it's not just a one-time sprint. We have to maintain it. Okay, we have to live it. That takes effort. And finally, maybe the discouraging part, but understanding that it is normal, there's relapse. Of course, there's relapse. And it doesn't mean it's the end of it, but it means that, hey, wait a second, we have to brush off, step up, and do it all over again. But with each time, it becomes easier and easier. So relapse is part of recovery. Here are some general thoughts. If you're ready for change, and that's what you have to decide, then let's start. Start small, 1 step at a time. Learn to say no to that inner critic in you. And you know what? Take a few minutes, an appreciation break, all right, and give yourself credit for trying. Be realistic. Perfection is not what we want anymore. Go for good enough. And certainly avoid falling in the comparison trap. Spend time with supportive people and do things you enjoy. Bottom line, your life does not get better by chance. It gets better by change. Okay, redefine what is healthy. Hey, that's a little bit of a problem in today's society. I'm not sure we really have a clear message. But you know what? In our own heads, we can go back to a basic concept of common sense, moderation and balance. That's where it's going to sit. So a general rule, and it may not be, exact, but think of the 80-20 rule. 80% healthy, nourishing, real foods, and 20%, sure, you can have that fun or accounted food. Bottom line, perfection does not exist. Remember, it was that perfection, that drive for perfection, for purity, that really got you into the orthorexia. So think healthy balance versus unbalanced health obsession. Well, this next one is what is normal eating, and you can see that's a big long list. All right, but it just has some common sense in there, and I'm not going to read all of that to you. You can take a look at it. And you understand that, it's sometimes you eat more, sometimes you eat less. You don't have these rigid thoughts. That foods aren't divided into good and bad without feeling guilty. And that, you eat when socially out and enjoy yourself. And you're aware that eating is not the most important thing in life, but knowing that it is important for good health, you're going to be eating in moderation. What eating is not, normal eating is not, is having to follow a very strict diet, having to eat special foods, unless you're medically compromised, having to weigh yourself constantly, having the assumption that you can control everything that goes into your body, and especially playing games with yourself. Sometimes rationalizing, well, dairy products make me feel nauseous, and so I don't have to eat them, when perhaps that really isn't the real reason, or becoming a vegetarian for health reasons, when the real reason may be to justify an excess of fruit and veggies. So let's look at what normal is and see, wait a second, maybe these are target behaviors that I would like to aim at. So maybe one of the first things we start to do, okay, is we start to make changes in our diet, and we begin by breaking those rigid dietary rules. Perhaps you'd want to make a list of foods that you previously enjoyed, but you've kind of excluded. Start with the one that is the least challenging, and then work your way up to the most. Pick one or two foods and put them back in your diet. Remember to select reasonable goals, and also write down your progress. It kind of helps you keep track of, wait a second, I was able to do this, and maybe I wasn't able to do that. And we're going to be taking a look at reasons why. But start by breaking those rigid dietary rules. Another strategy for taking charge and change is don't go it alone. And I want you to ask yourself right now, are there people out here who could be of help? I also want you to ask yourself, are there people out here that won't be of help, that really will give me a difficult time? Are you willing to let them help? Remember this social isolation, okay, and this kind of sense of control and superiority and allowing somebody to help you? Well, maybe you need to learn where your resources are, where your healthy resources are. So if you're having a difficult time, remember, create a support network. Add that support. That is critical at this point. Don't go it alone. Check out Annette's programs. These are all free programs. They have a helpline. They have a mentor program. People who've been through this, they're willing to reach out and help you. Grocery store buddies. Hey, we know how difficult it is to go to that grocery store. All right, they'll be there for you. Online support, the Annette YouTube recovery channel, the blog, and certainly there are the support groups in your area. Check them out. Call Annette. Okay, back to serious times now. We have these symptoms of orthorexia, and so the question is, well, what purpose does it serve? So questions that you ask yourself: is this where I get my sense of self-esteem, a sense of satisfaction, or even a sense of identity, okay, being one of the group? Is it also a way of me getting a sense of control? Sometimes my life is so chaotic that maybe food is the only thing I really can't control. And do I manage issues or feelings through food? That's why I wanted you to check, do a little diary type thing and see when you're having difficulty. Or do these symptoms help me avoid things that I'm really uncomfortable about? So avoidance is not the solution to anxiety, it feeds the problem. So are you feeding your problem by avoiding the foods that you're afraid of? Triggers. You have to identify them. Take that close look at when you felt compelled to return to old behaviors. Was there a trigger? I want you to be very mindful of social media that promotes dieting and clean eating, etc. These are very powerful messages. We're getting them all the time, everywhere we turn. Even our own peers are very, very much into this kind of behavior. So you ask yourself, was there a situation that created that distress? Was I at a restaurant? Was I at, another situation where food came up? And what was the feeling maybe that triggered, oh my gosh, I almost feel like I'm going to go into a panic attack if I eat this. Something terrible might happen. What were those feelings that were surrounding the triggers? Begin to really take a look at your behavior. Now, there are particular types of triggers. The external triggers, for instance, are certain fear foods, foods like perhaps dairy or something that contain gluten or something that might not be organic. Look at those as trigger foods. Then interpersonal conflicts. This arises so many times, and particularly with family or close friends, where there's reasons why you can't eat with the family, why you can't be with the family, and those external triggers, okay, can create even more difficulty with thoughts and feelings. Or specific events. It may be, hey, wait a second, there's a party, or we're going out to a restaurant, and I just can't do that. It's going to create a problem for me. And be very aware that social media, that is a constant for us. We are always on the internet. We're always texting. We're always changing recipes. That type of trigger is going to be very, very important. And you're going to need to learn how to handle that. Then there's internal triggers, physical sensations. Not only is there anxiety, and this is a real feeling, but many times individuals will really anticipate, let's say if they've had some gluten, that they'll have some GI problems, or if they're allergic to a certain food, like dairy, that they're going to respond to it. Those are physical sensations, and they really reinforce the fact that, wait a second, this is a dangerous food. Then there are changes in mood. We can tell at times when we're anxious or depressed. Those are internal triggers, and again, getting a sense of, hey, wait a second, I've got to do something to cope with this. And this is where you start to use food to really cope with anxiety and stress. Well, dealing with triggers, be proactive. So what are the ways you can deal or modify a trigger? Well, we talked a little bit about avoidance, and one of the things we recognize is that avoidance doesn't solve a problem, okay? And one of the things that you've done with, with your symptoms of orthorexia is you've constantly avoided specific foods. And of course, that hasn't worked. But avoidance of certain things is really helpful. For instance, avoidance of the internet and social media, that will promote, these exclusionary diets. That's where avoidance might be very beneficial. We also modify. A lot of times it's not an all or none, but we can do parts of it so that it's not 100%. And sometimes we just can't modify a trigger. We have to accept it. And so those are the three ways that basically you can start to deal with a trigger. So think about it. It's not an all or none, but think of how you can handle those triggers in a proactive way. You know that they're coming, and so why not plan? Dealing with anxious thoughts. Well, remind yourself as you're beginning to change and as you're beginning to incorporate new foods and fear foods into your life, you have to remind yourself that foods are okay in moderation, and you really need to be careful of that all or none thinking. Um, I ate ice cream yesterday with high fructose corn syrup. Now my life is ruined and I'm a failure. That's that catastrophic all or none thinking. So if you want to eat organic, chemical, and antibiotic free, it doesn't mean that you have to do it 100% of the time. Loosen up a little bit. And what you need to understand is you need to be less judgmental and much kinder with yourself. Don't set up your own guilt. Learning to deal with anxiety. There are lots of ways of doing that, but one of the most popular is learning mindfulness. And I really suggest that you get some good education on this and get some good resources, and it has quite a few. But learning to control your mind so it doesn't control you. Stop cluttering your mind one thing at a time. So, mindful or mindful? You choose. Okay, what if I fail? Well, it's okay. Stop trying to be perfect. Forgive yourself and move on. And the challenges will become easier as time goes on. Should I seek professional help? Well, if your anxiety is really high, or you see that you're really having problems changing your diet or your beliefs and you're struggling, well, then certainly it's a good idea to seek help from a professional who is trained in eating disorders. I think that's very important because remember, orthorexia is kind of the hidden eating disorder, okay? And when we talk about healthy and wellness, we may find that we get a lot of reinforcement from even professionals who don't quite understand how significant a disorder this has become. So the second point is also it might be important to make sure that some other disorder is not really playing a factor in your recovery. It may be an issue with obsessive compulsive disorder. It might be depression. It might be other things. But remember, you really need to look at this carefully and understand what all the things are, what all the factors are that are playing in a role. So eating disorder specialists usually come as teams, and it's a medical doctor or a psychiatrist who can monitor the medical issues. It's a registered dietitian who will give you good, solid recommendations, and particularly if there are nutritional deficiencies. And it's a mental health professional that will help you work through some of the issues underlying the orthorexia. Is there hope? Oh, absolutely. You certainly may not have made the choice about developing orthorexia, but you can make the choice about working toward recovery. But I want you to remember that recovery is never easy. It's never just a straight uphill kind of progress. And it's a marathon, not a sprint. So take it step by step, take it slowly, but have a goal in mind. Make recovery a real priority. Don't put it on the side. Don't wait. Don't wait until you're totally overwhelmed by it. It's important. It's your life. So recovery, number one, realizing that you're worth it. You're worth fighting for. You're worth it. Experiencing true happiness and caring about yourself and overcoming your own demons. Validate your own worth and eating without regret. And understand that relapse, it's going to happen, it's inevitable, and that's okay. It's part of what recovery is all about. And most important, yearning to live a life filled with good things, not just food, and ideas about healthy food. So remember why you wanted to recover in the first place. And remember, life is more than obsessing just about food and health. Well, I hope this brief presentation helped you understand a little bit about orthorexia and about maybe how you can take some initial steps in really conquering this problem and getting well. I invite all of you to join us in the fight against eating disorders at ANID and take the ANID pledge. Let us hear from you. We're interested in what you have to say and maybe what helped you recover. So thank you so much, and we'll be seeing you soon.